We live in a great location, and that really was one of the more appealing things that I find as I've interviewed other providers be very interested in. The fact that we do live in an area where they will know that their partners, spouses, and family members will be very happy because they have access to so much. Like New York and to New Haven, to Hartford, and the Boston area are so close. You can go across the Long Island, across the Block Island. It's easy access to Newport, Rhode Island. I mean, it's phenomenal. This population has a multitude of problems. The consequences of poverty, I think, is a major variable, and the fact that patients don't have access to health care, in addition to the fact that they are of groups that traditionally have higher health conditions such as diabetes and asthma in African Americans and Latinos.
Anybody who comes to work in this area, in any community health center, has to have the passion, just to help the underserved population, because it could be challenging, but it's very rewarding.
What I'm proud of is to give them the standard of care. And sometimes they're actually pleasantly surprised the quality of care they get. And when they come here, we don't only address actually their acute health issues, but we ask them how they do in school, have they been to a dentist. If not, we have a full-time dentist and dental hygienist. They take care of our patients. We have an OBGYN. We have an internist who takes care of our adult patients. So we try to accommodate all their health needs.
Many of the providers that come here are what we call mission-minded. They come here for a purpose. Many of our providers are bilingual, speak Spanish. A number of them speak French as well. So we have multilingual staff. We have multicultural staff as well. Our patients are very diverse. We have populations that are impoverished, and as well populations that are well off. So I myself take care of a few attorneys, members who own companies, as well as the general population of patients that are in greatest need, which is, of course, where we are, because we are a federally qualified health center. So it's very encouraging to know that providers come here with some of those skills. So if someone is very interested in affecting different populations and using their background, their knowledge, and if they have interest in learning new languages and meeting different people, this is the type of practice that they'll feel more fulfilled in. I myself went to Harvard College, and I am a faculty member at Yale School of Medicine, and I think that the opportunities that are available for families of physicians and other providers at the health center are excellent. Obviously, these schools are outstanding. Brown is not too far from us in Rhode Island. Columbia is in New York City.
So we have attendings from Yale come and give grand rounds, so you're in touch with them. Or if you have complicated patients, we refer them patients all the time.
The salaries and the benefits that the company offer are very comparable to a private practice package. And then I think you just have the backup, just with the other professionals that work with you. So you have the support services, social services, we have dental, we have a lot of, just ancillary services.
And also lifestyle as well. You have a certain hours that you agree on, and some of our adult providers actually don't even take necessarily hospital calls where they don't round in the hospital.
And it's beautiful. I mean, this area is really, really beautiful. It has the 4 seasons, and so it's ideal.
Some of the best restaurants in Fairfield County are in Fairfield, Connecticut, which is almost within walking distance from here.
It's a nice suburb community to New York. Actually, many New Yorkers live in southwestern Connecticut. So it's lovely. I like being close to the water, to the coast. Then we have major airports in the area.
The standards for schools are amazing here compared to other states. We have really beautiful and safe places to live here too, for kids to still play outside, and just if you want to raise a family in a lot of the areas.
And the private schools are top notch.
If you were brought up feeling that you want to give back, there's no better place to do it than in a community health center like this. It's not always easy, it's not always fun, it sometimes pulls at your heartstrings, but the opportunities really abound as far as taking care of different people and doing different things for them.
You have to be passionate about what you're doing. And so in 26 years, I still feel excited about coming to work, to serving my community, to seeing the patients that I've been taking care of for a long time. Each and every day is a new experience.
And then, of course, the little moments, really, the little moments, the little differences that you make every day. A patient that didn't have the medication, that you actually somehow find a way to provide them with the medication.
It's basically the patients that really makes it a good company. Well, the benefits are good for Optimus, but really it's getting to see the patients from when they're little, they come in, they're 2 years old, then they're 5, and they're just older, and it's good watching them grow.
If you enjoy community health medicine, you're just very, very lucky to be working here. This is a very nice site for community health medicine. It's always very interesting, it's always very different, but most importantly, you always feel like you're doing a good job. You always have the opportunity to take care of people, leave your office, go home and say, I did good things today.